Hello everyone, welcome to sqadia.com. My name is Dr. Saima Mushtaq and our today's topic of ENT is adenoidectomy. Adenoidectomy is the removal of the adenoid tissue. Ectomy is the removal, and adenoid is the term used for the lymphatic tissue that is present in the upper part of the neck behind the nasal cavity. So adenoidectomy is the removal of adenoid tissues. And we will discuss this topic of adenoidectomy in three different sections. In the first section, we will talk about the adenoidectomy as a whole, what is adenoidectomy and why we need to perform it, what are some indications or conditions in which we need to perform adenoidectomy, and what are some conditions in which we don't need to perform adenoidectomy, or we should not perform adenoidectomy, better to say, because some contraindications are present, or the benefits of performing adenoidectomy are less as compared to the complications that can occur as a result of adenoidectomy. And then we will also discuss whether we will need general anesthesia or the local anesthesia for the procedure, and how should be the position of the patient with the adenoidectomy. Then in the second section, we will talk about the procedures that can be used for adenoidectomy, what are the steps of adenoidectomy, what are some other procedures besides using the curate for removal of the adenoid, what other procedures we can try for performing adenoidectomy, and also another term which is used, or the another procedure which is used, is endoscopic adenoidectomy. We will discuss about that also. Then in our third and the final section, we will talk about the post-operative care, how we should manage the patient after the procedure. And since the most important complication that can occur after the procedure is the haemorrhage, which sometimes can be a massive haemorrhage, how we can manage the patient with that, and also how we should manage the diet and the oral hygiene of the patient with the procedure, how long patient needs to stay in the hospital, and how long we need to give them analgesics and antibiotics in the post-operative period. So all that we will discuss in our today's topic of adenoidectomy. Keep watching sqadia.com.